You can make it. You can create your online course. Hello guys, this is Bisan, and in this video we are going to talk about the problems and the challenges that are facing pharmacists in Lebanon. If you are new to this channel, make sure to like, to comment, and to subscribe. Let's start. Pharmacists in Lebanon today are facing many challenges. The first challenge, that's the economic crisis. The economic crisis has had a significant impact on pharmacists. First, there was a shortage of medications. According to the Order of Pharmacists in Lebanon today, more than 40% of medication is currently unavailable, and this has led to patients unable to get some vital medications. 2, decrease in sales. Pharmacies in Lebanon today have reported a decrease in sales, and some pharmacies have reported a 70% decrease in revenue. And this has led to some pharmacies either closing down or reducing their staff. 3, inflation. The devaluation of the Lebanese pound has led to a sharp increase in the costs of medications and medical devices. And this has made it really challenging for pharmacists to be able to purchase and to sell products at affordable prices. 4, increase in counterfeit drugs. Due to the high increase in the cost of imported drugs, many patients have today turned into the use of counterfeit drugs. And this definitely has dangerous and life-threatening consequences. And this has also led to some unethical practices by some pharmacists who were tempted to sell counterfeit drugs in order for them to make some profit. 5, immigration of pharmacists. Due to the economic crisis, many pharmacists in Lebanon have chosen to leave the country in order for them to find better opportunities. This has led to a shortage of qualified pharmacists and an increased burden on the pharmacists who remained in Lebanon to provide good quality health. Now let's talk about the political instability. The ongoing political instability in Lebanon has had a negative impact on the pharma industry and pharmacists in particular. First, we had a decrease in patients. The political instability in Lebanon has led to a decrease in the number of patients simply because those patients were either scared or afraid or could not get access to healthcare facilities due to some security issues in Lebanon or probably some roadblocks. And this has led to a decrease in the revenue of pharmacists in addition to prescriptions not being filled. Number 2, shortage of medicine. The political instability in Lebanon has led to a shortage of medicines simply because the pharma companies could not be able to import vital medications due to the unrest and the conflict in the area. 3, increase in prices. The political instability in Lebanon has led to an increase in prices of medications simply because the pharma companies, suppliers, and distributors were facing additional costs due to disruption in their supply chain and additional costs on transportation. 4, difficulty in obtaining licenses. Due to the political instability, it was harder for pharmacists to obtain licenses and permits to work. And this has created an additional burden on the pharmacists who were already facing lots in order to stay afloat in this hard economic time. 5, brain drain. The ongoing political instability in Lebanon and the economic crisis has led to a brain drain of professionals in Lebanon, including pharmacists who have left the country for better opportunities abroad. And this has led to a shortage in professionals staying in Lebanon and an additional burden on those pharmacists that were already remaining in the country. Now let's talk about how the lack of regulation has impacted the pharma industry and pharmacists in particular. First, counterfeit drugs. The lack of regulation in Lebanon has led to a proliferation in the sales of counterfeit drugs. And there's an estimate that says that 30% of drugs that are currently circulating in Lebanon are either fake or substandard. 2, unethical practices. The lack of regulation in Lebanon today has led to some unethical practices among some pharmacists. And these include selling counterfeit or expired drugs, overcharging patients, and providing unnecessary or inappropriate medications. 3. Low quality medications. The lack of regulation has also led to selling low quality medications, and these can definitely have serious effects and consequences on the health of the patients. 4. Lack of standardization. The lack of regulation has definitely led to a lack of standardization because the pharmacists could not tell whether or not the drugs sold were safe or effective. And finally, that's number 5, that's risk to patient safety. The lack of regulation has created a significant risk on patient safety because pharmacists could not tell whether or not the drugs that were sold were ineffective, harmful, or even deadly. Now let's talk about how the limited access to healthcare has affected the pharma industry and pharmacists in Lebanon. Number 1, we had an increased reliance on pharmacists. Due to the limited access to healthcare facilities, many patients have relied on pharmacists for medication management and healthcare advice. And this has also placed an additional strain or additional burden on pharmacists because they had to make sure that they were providing good quality and good medications to patients. 2, decreased access to medications. The limited access to healthcare facilities has led to a decreased access of patients to their medications because simply the patients could not get to the medical facilities to get the prescriptions of the medications that they were taking. 3, increased demand for OTC or over-the-counter drugs. Due to limited access to healthcare, many patients have started using OTC drugs for their mild or minor illnesses. And this has led to an increase on the demand of OTC drugs, and it also has led to pharmacists shifting the medications that they were dispensing. 4, increased need for patient education. Due to the limited access to healthcare, many patients were relying on pharmacists to get more information about the products or their medications, the dosages, or even potential side effects. And finally, number 5, that's limited resources. Limited access to healthcare has also led to a limited strain on the resources of pharmacists, especially that pharmacists had to provide extra services, including probably delivery of products in addition to more patient counseling. And finally, let's talk about the high competition among pharmacists. This high competition has impacted the pharma industry and pharmacists in specific. First, the price competition. The high competition among pharmacists has led to price competition because pharmacists were offering either discounts or promotions on some products in order to attract customers. This has led to lower margins of profit for pharmacists, and pharmacists have to do something more in order for them to reduce their costs. 2, increased workload. The high competition among pharmacists has led to an increased workload among pharmacists because they had to work additional hours or provide extra services in order for them to compete. And as a result, some pharmacists either were burnt out or dissatisfied with their jobs. 3, focus on sales. The high competition among pharmacists has led to some pharmacists focusing more on sales and profit more than the quality of the patient care. And this has led to unethical practices and a negative impact on the patient's quality care. 4, innovation and quality. The high competition among pharmacists has encouraged some pharmacists to be more innovative. And this has had a positive outcome for the quality of the patient care. 5, market saturation. The high competition among pharmacists has led to market saturation because a big number of pharmacies were competing for a fixed number of customers. This has led to a decrease in the profitability and sustainability of smaller pharmacies. Again, these are some of the challenges and problems that are facing pharmacists in Lebanon, and to address these issues, we need collaboration and action from the government, from regulatory bodies, from healthcare providers, and from the whole pharma industry as well. You can create your online course. If you want to know more, check the link in the description of this video and visit our website and join our next free webinar on how to generate a passive income from online courses while you are staying at the pharmacy. You will also find other free resources on communication, on leadership, and on personal development. I remind you, You are just one course away. See you in the next video.